It's good to have you on the show for this very, very important conversation. Thanks for joining us once again. But I'm just going to go straight into it. In the 90s and the 80s, we saw a lot of people pass away from HIV. But as time went on, you know, we got medications and all of that, and we started seeing people live happily with HIV. Some of them marry and even give birth to children. But oftentimes, people are still complaining that these treatments that we talk about is still very difficult for people to assess these treatments. I just want to start with this question first. And then secondly, I want to speak about the fact that also, as we speak about the fact that HIV has reduced a bit, when you go to hospitals, you still see a lot of people trying to get access to these drugs. Now we also know that HIV is not just sexually transmitted. You can get it from so many avenues. What are we doing to protect people as well? But most importantly, how are they able to access these drugs that keep them alive?
Thank you very much. Good morning, and thank you for having me. I would say that we've come a long way in the journey of HIV. The first case of HIV was first detected about 40 years ago, and a lot has been done. But I stand bold to say that we have very potent medications, very potent anti-retroviral drugs available, and they're available even here in Nigeria. We have them even in our PHC, primary healthcare facilities, our general hospitals, our teaching hospitals, across board. Across Nigeria, we have over 40,000 health facilities that are actually, providing HIV care and treatment to people across Nigeria. So I don't think at all that we have any challenge of people accessing HIV medications. We do facility-based testing as well as community-based testing. We have some partners that we work with that go to the communities, or even those in the hinterland, hard to reach areas to do the testing, and there's a mechanism to link those that are found positive to care. So I stand bold to say that we have the drugs, the potent medications available in all our facilities, and the good news is that they are even free. They are free to procure, or rather to access. So I think the major, the bane is the issue of stigma and discrimination. Many people, when they test positive, despite the counseling and despite the advice, people are still a bit afraid because of the stigma that is associated with HIV. But the good news is, one, HIV is no longer a death sentence. Like I said, we have very potent medication. In fact, if one tests positive today and you start the treatment, if by the time you test in another 6 months, the virus may not be detected in your bloodstream. That is not to say you are cured. There's no cure yet for HIV, but it can be successfully controlled. I always use the example of having an elevated blood pressure. If you go to the hospital today and they tell you that your blood pressure is high and you start medications, in another 6 months you may go again and they tell you it's well under control now, but continue using your drugs so that it remains so. It's the same thing for HIV. You test today, you are positive, you are counseled, you are put on life-saving medications, you are compliant with those medications, and you use them as prescribed. In another 6 months, the virus will not be detected, but that is not to say you are cured, but it's to encourage you to continue to use the medications. And that is what we refer to as U equals U, undetectable equals untransmittable. And that is what we are preaching, that if you use your medications, you stay on treatment, the viral load is so suppressed that you cannot transmit it to other people. And that is what we need. And that is why we are appealing to every Nigerian to avoid stigma and discrimination, so that people can actually come forward and take these free medications that are available and provided by the government.
It is heartwarming to it's heartwarming to know that the medication is still free, and